Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. I just want to start off by saying a big thank you to everyone who's got in contact over the last few weeks to see how I am. I know there's been a lot of concern, but guys, I'm totally fine. The reason for my sudden disappearance is that I just had to really get my head down and focus on launching my new product called the Wax Scope, which some of you may have may be aware about. And I'm glad to say that the Wax Scope has now got an official launch date of Friday the 12th of April. In fact, it's ready, but we're just coinciding it with our first training course. So we just decided to do that a few weeks away to give an opportunity for people to enroll into the course. I think we may just only have one space left, if I'm correct. So, and as part of the launch of the Wax Scope and the new training program, I've completely revamped my theoretical training course. I've put everything into this. I think if people know me, they know that I'm not going to do it half-heartedly, and it's pushed me to the limits, if I'm honest. It's been quite grueling, and I've just started from scratch. I've literally written the A to Z of earwax removal. But not only written it, I've presented it in PowerPoints, and I've narrated over it. So it's 15 hours of me talking non-stop. So for some of you that might be heaven, but for some of you that might be hell. For me, I'm sick and tired of hearing my own voice. It's just been, it's constant talking into a microphone. And when you're doing these narrations, if you make a mistake, I just started from scratch. Some of these slides are like 10, 20 minutes, and it could be the very last minute where I've probably said something slightly inaccurate or I wasn't pleased, and I've just started from scratch. But I am my own worst enemy. Anyway, guys, that's kind of been launched now. These modules are only accessible to candidates who are enrolling under the course. In future, I might actually write a book, because I've got all the material now, and it's really, really extensive, in-depth knowledge. So I might just now put that into some sort of kind of ebook manual, which can be available to everyone. I'm not sure. I'm just going to think about that later and just focus on the launch of the Wax Scope. So yeah, guys, thank you so much for all of your kind words of support. I'm totally fine, but I didn't realise how much doing social media takes away from my kind of other things I'm actually be doing. And it wasn't just social media. I kind of, again, if I've had messages from other people as well who know me, and some of you may have been greeted with a very short reply, and it's just that I've just been off my phone. I just had to I've literally locked myself in a dark room, and I've been at the clinic most nights, I would say, and it's no exaggeration, but till about 12:01. And yesterday I got home at 9:00 in the evening, and I didn't know what to do with myself. So I put my feet up and I watched a nice movie, and it felt really good. So I'm really sorry. I just had to stay away and just get my head down without any distraction whatsoever. And if it wasn't the case, if I was still doing the videos, I'll probably be another few weeks away, even a month away from getting where I am now. So guys, if there's any specialists watching this, I know there's a lot of specialists that watch this. The Wax Scope is now officially launched. I've put another video up on the Clear Wax YouTube channel. You'll see the link in the description, so please visit there. A lot of you know about the Wax Scope already. If you are interested, please do contact us. The email address is also there, info@clearwax.co.uk, and we can add you to our mailing list. We've got our first training course coming soon. For people who are already performing earwax removal using direct visualization, so an endoscope or head loops or an ENT microscope, the Wax Scope is designed in such a way where it's actually kind of like a video otoscope, which all kind of ear specialists should be comfortable using. So you may not actually need direct training for it, so face-to-face. There could just be some online training, because essentially all the skills you've got is transferable and it's easier. But because it's a new product, I don't want to start selling that product to experience. These are for people who are already doing wax removal, guys, not anyone who's new to it, even if they are suitably qualified. If someone who's never done wax removal but they are suitably qualified, they have to come on the course. But for people who already experienced it, with an endoscope it's different. With an endoscope you could be doing earwax removal using a microscope or loops, but those skills are not really transferable to an endoscope. And in fact, experience has shown me that it's actually easier to teach someone to use an endoscope. So again, someone who's suitably qualified, like an audiologist, a nurse with ear experience, or a paramedic with ear experience, or a GP or an ENT, or a hearing care assistant who's been qualified for a number of years and they've got supervision at hand. It's easier for me to train these suitably qualified professionals and clinicians to use an endoscope if they've never done earwax before. It's the people that have used a microscope ahead. It's because the skills are completely different. They're non-transferable. They're really not. And the way you position your hand and you hold the instrument is completely different. So so the wax scope, we've had a lot of interest from abroad, and I know a lot of people will probably be watching this video. So guys, when we start selling in different countries, we have to get all the regulations, so it's all going to take time, but just bear with us. We're just going to, I've put everything into this, so I just want to focus on the UK first, and the European market, and just make sure it's running as I want. So, but yeah, it's exciting times ahead. The hard work now begins, I think. It's been a long journey, 2, maybe 3 years. In fact, the wax scope was the concept conceived back in 2017. I remember the day very vividly indeed. And I put a hand to paper and I drew exactly what I wanted. And to be honest, the end result's not too far off. So I'm fine, guys. Don't worry. And we'll just go back to this case. So this patient, you can see they've got really sticky, kind of caramel type of wax. Loads of keratin dead skin here. It's probably a type 6 scale on the modified Rye Bristol stool chart or Ceremon chart. Some of you may have seen this chart that I developed, and I've included it into our new training material. And some of you may have been wondering, why didn't I use the correct? Now I used the correct on the other side, and that'll give you kind of a hint. Sometimes the wax can be too stodgy like this, and the keratin can be too stodgy. And when you use the correct, you're just spreading it against the canal wall, and it's even more difficult to remove. In fact, I did make that kind of mistake in the opposite ear. And I did get a lot of wax out though, but then I had to resort back to the microsuction. And also this case, the wax, when it gets deep against the eardrum, you can't really use correct instruments like that. Maybe the Earpick, because if it's low profile, it's very it's got a small diameter tip. But again, for the new Earpick that I've developed, it's not suitable for this. I did read somewhere actually that I think so some of you guys may know my colleague Connor, who's got his own YouTube channel, Durham hearing specialist. So Connor contacted me, and I've also had contact today with Reese's company, clinical leads contacted me today, and they wanted the new instruments to give it a try. And so although we're officially launching them on the 12th of April, I've made, if they want to purchase it, I've just kind of given that allowance for them, because I've worked with both of them before. And so Connor did a video recently, and I did watch that, so it's very interesting to watch, and he did really well, because I didn't realise Connor, he mentioned in the videos that he doesn't use instruments as much as he feels he should, and I agree. I think a lot of us kind of are probably a bit more reliant on suction than we should be, and I think mainly because we just don't want to cause trauma to the ear canal. Whenever you use instrumentation, you're more at risk of making contact with the canal. My clinical practice has changed a lot in the last few weeks, if I'm honest. During this new training course that I've developed, again, I've left no stone unturned. I've looked at research papers, complication rates. I've done so much things, and it actually has made a big impact on my clinical practice, and I'm actually using the instruments far more now. And that's partly also because I've got these new instruments. I think the current instruments in the market are very limited, the straighter ones. Having the angulation on them, the bent distal end, just opens up a whole new world, and I'm using it a lot more. I read, going back to the point, I read one of the comments, and they were like, I nicked the idea of the Earpick from someone from China. Guys, if that is the case, please show me the video where I've actually used this Earpick from China. And there's going to be loads of instruments out in the world. It doesn't mean I've nicked an idea. The Earpick, actually, the way I developed it, believe it or not, you will not believe me. Wish I had video footage. I've got all the diagrams though. I got an earwax, one of the normal earwax I used. I snapped off the distal end, the blunt end of it, the L part of it. I then got a grinder, which I use for ear molds, because obviously as an audiologist, we have patients who wear ear molds, and sometimes you have to kind of modify the molds to make them fit better. So I've got this handheld grinder tool and polishing tool. I was stood with a face mask, goggles, over the sink in my clinic, kind of not even the clinical area, it's the back area of my clinic. And I was drilling away, getting these curves, getting the angulation to tips. So no, yeah, it was just really funny reading stuff like that. So guys, just calm down a little bit. Just you don't know why you have to be so kind of almost controversial. Just let it be. Just take a chill pill, some of you guys. It was just a couple of comments that I read was so funny and hilarious, and if only they knew how much work I put into this. And of course, there's other stuff there that's in the market. You might get inspiration from, but the Earpick was a concept completely in my mind, and I actually developed the Earpick to work with the wax scope, because the ear hook can be a bit difficult to use. So with the wax scope, you have to use the angled instruments because of the way you're entering the ear, because you've got a speculum attached to a device. So the straighter instruments are much more harder to insert, so you have to have the angulation. And with the ear hook, because you've got two kind of junctions. You've got the junction at the end where the actual hook is, and then you've got this additional bend. So when I used the I'll come back to that in a moment. So this is when I used the Raithatha, and yeah, I did get a lot out, but you're going to see I'm going to spread it against the posterior superior canal wall. And then I had to go back and put some oil in. So with the wax scope, with the ear hook, because I normally, when I use it, and different people are different. I know when I've trained people, they don't do this, but I've got a tendency, when I'm getting the hook in behind the wax and the canal wall, I then twist it in my finger. I rotate it in my finger, so it's like a lock and key mechanism. So that you can't swivel it with your finger with the angled ear hook, because you've got two bends. I hope that makes sense. When you swivel it, you're going to rotate one axis and then another axis. So you can still do it, but it's a bit more tricky. So you can see all that. I've spread it against the floor. And I'm going to try and rectify it, but you can just see some of it is coming away, but I'm spreading a lot of this as well. But yeah, but the fact that this has got an angle, it just allows me much more access. So with the ear hook, I needed to come up with another concept as a replacement to the ear hook, because it has this kind of parallel L bend. So with the Earpick, it's a complete different angulation. You're not having to rotate it in your fingers. You're almost using it like a correct. And the Earpick for me has become one of my favourite instruments, and I've got loads more cases. And to show you guys with that, and even if it doesn't remove all the wax, it opens up space that I can then put drops in or use another instrument. It's kind of, and the correct, I don't really use the ear hook much now, guys. Nowadays, you may have noticed that, because the correct's just got such a thin profile. It enables me to glide in spaces. I still use the ear hook, don't get me wrong, but far less. And I'm more reliant now on the correct and the Earpick. But yeah, so you're going to see me using them a lot more now. You'll notice there's probably other subtle differences in my technique that I feel is, for viewing pleasure, it may not be great, but for patient comfort and for procedural ease as well, it's going to be more beneficial. So yeah, it's going to be interesting times ahead. I think this patient had been poking in their ear a little bit. I think they mentioned it. You might have seen it. There's a slight bit of swelling just to the right there, superiorly and posteriorly. It may come in view just near where the suction probe is, just underneath there. So yeah, got the blockage out. I'm just mopping up around the edge a little bit. Here's some sticky wax. There we are. And just gonna again use the fine end, I think, in a moment. Here we are. So yeah, another project I'm starting soon. I'm developing my own range of suction tips. They're a complete different style. The ones I'm developing, they're very more used abroad in different countries. In the UK, it's a different. So I don't want to say too much at the moment, but so obviously I became privy to some of these during my training. Recently I'm developing, and some colleagues, some ENT colleagues that I work with in American, it's kind of what they use, and I thought, well, let's try these, and they've got so much more benefits. So I'm launching that. So I've developed my own kind of handle grips, because people hold suction tips in different ways. You've got different grips. You've got a thumb grip, you've got a pen grip. So I don't want to say too much more, but yeah, I've really worked on that. And also the length of the devices, the diameters. Hopefully I'm going to get this launched again in the next, I think realistically it's going to take me 6 months, but it's well on the way. And then the last thing I've got to do is develop some more forceps, and I think I've got every instrument available, all the different visualization methods. So, and hopefully all this is going to make a difference to specialists and ultimately the patients who are being treated. That's what it's ultimately all about. It's developing innovative products to help specialists and their patients. So again, the wax scope, some of you may hate the view, but that's the best view, other than, in my opinion, other than an endoscope. And it's all good and well having an endoscope with amazing view. And I wish everyone could use it, because I wouldn't have to develop another device. But the truth of the matter is, not many people can use an endoscope. It is very tricky, and I kind of, we spotted that very early on during our training. So what good is the view of an endoscope if a lot of people are not able to execute the view and make use of the view? So then a lot of people are using other devices which are substandard in many different ways, and that's the development of the wax scope. So the wax scope for me is the next best alternative, and in some cases I would prefer the wax scope over the endoscope. So that's the patient's eardrum in a moment. Just see how bendy the ear is. I'm having to really rotate. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye-bye.